Okay, hello everyone. Thank you for tuning into this CE presentation. My name is Nikki Griffith and I'm one of the PGY1 pharmacy residents here at UVA. Today we will be discussing managing pseudoscience beliefs on the front lines, a review of vaccine safety and efficacy. As pharmacy technicians, you are prime individuals within the healthcare field to have very open and particularly not as formal conversations with patients about their vaccine beliefs and practices. So I think this is something that's very important for you to be aware of and really seize the opportunity when you have it. We have this accredited through VCU, and here is the accreditation slide. We do not have anything to disclose regarding the development or presentation of this slide deck. And here is the accreditation formally written out. And here is where you can get your CE code. So I'll leave this on for just a moment so you have a minute to take a picture of that, and you can follow the instructions to text the code and then go on the website and answer whatever questions you need to. So I'd like to start out today by talking about dihydrogen monoxide. And studies have found that ingestion within the past 12 months is associated with 100% of cardiovascular deaths in 2019. This is an oversimplified example of what we as healthcare professionals often see in society when we're seeing scientific concepts and healthcare concepts interpreted not quite the way that they should be. So dihydrogen monoxide is water. So of course, everyone that had a cardiovascular death in 2019 had ingestion of water within the past 12 months. And this is a simplified example, but it's just something to keep in mind as we move throughout this presentation, that the way things are presented to us can sound very good and can sound like cause for concern, but you really need to get down to the root of what substances are. Dihydrogen monoxide sounds like a crazy chemical, but it's actually just water. So we kind of need to really take a deeper look into the things that we're talking about when it comes to our health. By the end of this presentation, I would like for you to be able to identify common misconceptions regarding vaccine safety, as well as review available information regarding vaccine safety and efficacy, and review techniques to promote evidence-based decision making. Andrew Wakefield is at the core of the vaccines cause autism movement, which is really what started all of the questioning of the safety of vaccinations. In 1998, he published a study in The Lancet, which is a well-known medical journal, regarding Mmr Vaccine in relation to the development of autism and intestinal abnormalities. He had a population of 12 children, so it was a very small study. However, his research was found to be conducted irresponsibly, and his paper was retracted in 2010, meaning that it was found to be completely invalid and was pulled out of the medical journal. It turned out that he had actually hand-selected essentially those 12 children with a population that he thought may support his claims. So whether the children already had some inclination of having autism or potential development. He also ignored inconsistent data. So out of the 12 children that he studied, much of the data didn't actually support his suspected association with autism and intestinal abnormalities. And he essentially just ignored that data and did not publish it in the paper. And he therefore drew his conclusions from an incomplete data set. So it was found that this study was completely invalid, and the results of it were not supportive of autism being at all related to vaccines. So, however, once that was on the internet and out there in the public, it was already out there, and a lot of people, it caught traction, and that is where we currently have the anti-vaccine movement today. But I think it's very important to take it back to the core and understand where this came from, and if we should even still be talking about it today. A similar comparison would be to take any patient diagnosed with autism and see something that they all do in their lifetime, which is essentially what Andrew Wakefield did with vaccines. He said, hey, almost everyone gets vaccines. What if it's causing autism? Well, without any theory as to how that would really work, you could say that about anything. So patients diagnosed with autism, you could say that all of these patients ate oatmeal at the same age. Well, yes, but most children eat oatmeal at the same age because it's the first solid food they eat. That does not mean that the consumption of oatmeal is implicated in the development of autism. And this is what we have research for, is to study these hypotheses. And normally we like for the hypotheses to have some sort of theoretical basis to them. But again, this is why we conduct research, because even when they do have a solid basis, they might not be found to be accurate. And this is the importance of responsibly conducted research and responsibly interpreted research. So here we have the parachute study. This was a study that was published in an English medical journal, a very well-known one, with the purpose of evaluating if the use of a parachute prevents major injury or death when jumping from an aircraft. There was a population of 23 adult aircraft passengers, and the intervention was that passengers would either jump from an airplane or a helicopter with an empty backpack or with a parachute. Now, at the end of the study, they found that the incidence of death or major injury was not significantly reduced by the use of a parachute as compared with an empty backpack. Well, you could be saying to yourself right now, that doesn't make any sense. I know for certain that having a parachute is safer than not having a parachute when you jump out of an airplane. What you have to do is look further into the study to find that the mean velocity that the aircraft was going when the participants jumped out of the aircraft was 0 kilometers per hour, and the mean altitude at which the aircraft was flying was 0.6 meters. So essentially, these participants were jumping out of a plane that was on the ground. Now, it makes sense that parachutes did not provide any benefit in this situation. That does not mean that someone should jump out of an actually flying plane without a parachute. And this study was published exactly to hit at this point to talk about how important it is to responsibly interpret research on top of it needing to be done correctly. And in this instance, we were looking at this to say, okay, a researcher can do their study, can draw their conclusions, but you might have to dig for the extra data. You might have to dig for the information that's on this table. It might not even be presented in the main literature. It might be presented in a supplementary appendix. So again, just really honing in on the importance of evaluating literature, which is what our scientists are taught to do. And it is something that you can't do without training. And I think that's very important when we talk about people interpreting things off of the internet or saying that they saw a study that said this. It's not always as simple as it seems. So I think one big question when you really get down to the root of where this information came from, it seems like it should be very simple, that there was this idea from a physician that was completely discredited. He did very irresponsible things. But, we still have the anti-vaccine movement. This information is still out there. And I think a lot of this comes down to the internet and the open access that we have and very wide open lines of communication. So this information is still very widespread. And I do think it's very important as a member of patients' healthcare teams that you take a moment to kind of go see what's out there. So these are some of the most common websites that are out there that our patients may be looking at. One of them, if you'll notice, is Mercola Company. This is a physician. Dr. Mercola is a doctor of osteopathic medicine. However, he does not necessarily specialize in any one area, but has created a giant enterprise on health and nutrition and anti-vaccine movements, sells a lot of products, makes a ton of money, and he essentially has been widely criticized by the entire healthcare community as essentially exploiting his degree and promoting things that have no evidence behind them. He has been personally targeted by the FDA for promoting products that do not have any, for making claims to products that are not true and do not have any evidence. So he is very much criticized by the entire healthcare and scientific community, but he has made quite a large enterprise off of this. And some of these other websites are some things that I would take a look at just to see what's out there. It can be hard and it can be frustrating sometimes because you may know better than what's on these websites, but it's very important in order to keep those lines of communication open with our patients that we know what they're seeing on the internet. So I think talking about this kind of comes back to, well, what's the big deal if some people don't want to vaccinate their children? And the problem is that we have this whole host of infectious diseases that we had in history that went away because of vaccination. And vaccination really only works with continued vaccination and with herd immunity. So if you have this population that is choosing not to vaccinate their children, it really does put not only their children in danger that don't really have the ability to make their own decision there, but it also puts the rest of society in danger. So just remembering that in modern day, as modern day Americans, we have the luxury of not really knowing what these horrible infectious diseases looked like and what they did to the world. We are getting a very, very minor taste of that with the coronavirus right now, and hopefully that might shift a little bit of perspective. But remembering that this is nothing compared to some of these illnesses, and look at the rates from the pre-vaccine era to now. So if you look at the 20th century morbidity per year of smallpox and pertussis and polio compared to now, where in 2017 many of the reported cases were zero, that is due to vaccines. And that is something that I think patients often forget. They just take it for granted as this thing that we have that they can choose whether or not to get. But living in the time where we didn't have the vaccines was a very different story. This is something that saved many, many, many people and has made our modern life possible. So a great example of this is polio. So polio has been eradicated in most of the world. There were around 350,000 cases in 1988 and only 30 cases in 2018. It is estimated by epidemiology and studying of polio that if we had not made these advancements with vaccines at eradicating polio, we would have approximately 17 million people paralyzed today from contracting polio. Again, remembering that most people that are infected with polio do end up paralyzed. Definitely look into some of these illnesses can have the most significant impact here. Just make sure you know what these people actually suffered through. There are 3 countries that have not eradicated polio, and those are Pakistan, Afghanistan, and Nigeria. Their rates of vaccine coverage are not excellent, and that is why they still have rates of polio. So in 2017, their rates of vaccine coverage were 75%, 40%, and 60% respectively to each of those countries. So really not getting the rates that they need to truly eradicate the disease. And we also, unfortunately, have seen kind of a rebound worldwide of polio with these anti-vaccine movements. So from January 2018 to June 2019, there were 29 outbreaks across 15 countries. This is as compared to the year before, there were only 9 outbreaks across 6 countries. So that jump from 9 to 29 and jump from 6 countries to 15 countries impacted can be tracked and related to lack of vaccine coverage. So remembering that in this modern world where we don't think we have to worry about things like polio, if people stop getting vaccinated, we will. And I think, again, it kind of all comes back to that. You need to think about the risk and why we're vaccinating in the first place. We can also see this as with the measles outbreak that we saw just this last year, and this might hit a little bit more close to home because you could actually see it happening. Here to orient you to this slide, we have number of cases on the y-axis, and we have years from 2010 to 2019 with all of the bar graphs. As you can see, there was a bit of an outbreak in 2014. There were a lot of measles cases that year that was related to an outbreak in an unvaccinated Amish community, as well as a group of travelers from outside of the country that came in and spread measles. So these spikes that you will see are generally each year related to unvaccinated populations, and unfortunately it just depends how much it spread. That year in 2014, the Amish community was hit very hard with close to 400 cases just in their community. In 2018, you can see the rates were a bit up as well. This was in an Orthodox Jewish community that was unvaccinated. Most of those cases were attributed to that community. And then unfortunately in 2019, where we've been seeing a lot of push towards anti-vaccine movements, we had many, many outbreaks of measles. There were a lot in New York. I'm sure you saw it on the news. So again, here, remembering that we are not protected by the fact that we had vaccines in the past. We need to stay consistent with these practices. And I think this is really the core of where you need to keep the conversation open with patients, is that we are focusing on the risk of what happens if you do not vaccinate. So I think it's very important to understand how vaccines work, just to frame the conversation that you're having. I'm targeting the influenza vaccine here because I think it's the one in an outpatient pharmacy you will see the most often, and it's the one that's spoken about year after year. You may not have many conversations with parents about newborn vaccines in the pharmacy setting, but you will talk about the influenza vaccine. So essentially, the most common influenza vaccine is the inactivated influenza vaccine. So it has an inactivated influenza virus, and you inject that into the patient and essentially tricks the body into thinking it's infected with the virus. The very, very important thing to remember here is that the virus is inactivated, meaning it cannot replicate. So a patient cannot get the flu from getting an influenza vaccine. A couple of things that can happen are, one, someone could have been infected with influenza prior to getting the vaccine and then ultimately have the flu. That happens sometimes, and people then think that they got it from the vaccine, but again, it is impossible. There's no question. It's not feasible. And then also, you're tricking the body into thinking it has a virus. And what we associate our feeling sick with is actually our body mounting an immune response. So whenever we get a cold or we have some sort of infection, our body fights it. And that's where we get those symptoms that we have, our fevers, our chills. So patients will experience those feelings after they get the influenza vaccine, but that means it's working. That means that your body's responding to it, and that's exactly what you want it to do. When the body is exposed to the inactivated virus, your immune system produces immune cells, which are primarily your T lymphocytes and B lymphocytes, and they target the influenza virus and then get rid of it out of your body and fight it. This takes days, the first time that your body comes into contact with an influenza virus, which is the reason that we do vaccines. So when you get the vaccine, we say it could take about 2 weeks for it to really have efficacy. So you get the vaccine, your body takes a few days to make these immune cells. It fights off the virus that was inactivated. Again, you're tricking your body, so it's not going to replicate. It takes care of it. But those immune cells don't all go away. You have some memory immune cells that stick around. So then later in the season, if you come into contact with the influenza virus, rather than it taking a few days for your body to create those T lymphocytes and B lymphocytes, rather than it taking a few days for your body to realize that it's bad and it needs to fight it, your body will do it right away. And that's how you can fight off the flu faster than you would have if you wouldn't have gotten a vaccine. And this can make your flu shorter. It will prevent the flu from replicating out of control before your body attacks it. So you should have kind of a lessened symptomatology. So it does all of these things for you. And something that is important to talk about and is often quoted is the flu vaccine effectiveness every year. So to start, we need to talk about the difference between efficacy and effectiveness. Efficacy is whether or not the vaccine works, whether or not the mechanism of it works in a controlled situation. In a studied situation, we know that the flu vaccine works. That is from back when it was developed, and we have studied it since then. We know that if we have that a flu vaccine will protect you from an influenza virus. Effectiveness is what you hear about every year, and this is what's measured in the real world situation. So we have an influenza vaccine effectiveness network. In 2019 and 2020 season, it was estimated that our vaccine was 45% effective. What this targets is whether or not we selected for the appropriate influenza viruses. So I'm sure, as you've heard, like with coronavirus, there's actually a family of coronaviruses, and the one that is circulating right now is one that is a little bit more dangerous and more, it's more virulent, it's more disease causing. So there can be different types of one type of virus. So there are many different influenza viruses, and essentially what scientists have to do prior to the flu season is try to predict what's going to be circulating that year. You'll remember some bad years where the virus mutates, like the year that we had swine flu, and then our vaccine didn't cover that, and that's why so many people got sick. So that's really what this effectiveness is targeting. It's not whether or not the concept of the vaccine works, it's whether or not we picked the right strains. It is also important to remember that even if you get a strain of influenza that isn't the particular one, the influenza vaccine still helps you to recognize it faster, maybe not as fast as it would have if it was the correct strain, and should make your disease more mild. And something else I like to point out to patients when they're like, oh, I'm not going to get that, it was only 20% effective last year. Well, that is, let's say you encounter 100 people, 20 of those people have the flu and can give it to you, it'll protect you from those 20 people. So I think that's still worth it, and kind of interpreting it from that perspective too, especially with something that has little to no risk. Right. And just remembering that the influenza vaccine isn't just preventing you from getting influenza, it is also preventing you from having extra medical visits, hospitalizations, which cost money and can put you at risk for even worse infections. Being in the hospital is risky in itself, and then can also prevent deaths. And there has been a lot of literature done studying populations that have their influenza vaccine versus those that don't, and they have better outcomes in all of these topics, less likely to be admitted to the ICU. So just remembering that it provides a lot of protection aside from just not getting the flu. So I think the first thing that's always targeted when we talk about vaccines is the ingredients, and why is this in it, and why is this in it, and if those things are dangerous. So first thing is to remember that vaccines were something that were created to stop these very horrible infectious diseases. So it would be wonderful if we were able to create something that had no risk and eradicated diseases the way that vaccines have. But unfortunately, that's not possible. They do need some ingredients to make them work. So something that is largely targeted is thimerosal, and this is a component of mercury. And the purpose of it is to prevent growth of microbes and contamination of vaccines. So first point here, people get very scared at the concept of mercury, but when when you don't have a scientific background and don't know a lot about chemistry, you fail to realize that there's a difference between ethyl mercury versus methyl mercury. So there's a difference between quote unquote dangerous mercury and mercury that's okay. First of all, thimerosal is a mercury that is okay. It's not the dangerous one that we talk about coming into contact with. And additionally, it has really been removed from almost all vaccines as the US has turned to single-dose vials. So you'll notice just in the changes of production and our workflow in most outpatient pharmacies, you're going to go grab a flu vaccine and it's one shot for one person. You stick a needle on it and you give the vaccine. So that doesn't need something to prevent the growth of microbes because it's not a multi-dose vial that you're repeatedly accessing. So thimerosal is not in most of our vaccines. And additionally, something that's very important to think about is the fact that where this all started was with studying the MMR vaccine and how the MMR vaccine was related to autism. While many vaccines work very similarly, same concept, they do have different ingredients, and the MMR vaccine actually never contained thimerosal in history ever. So I do think it's interesting that this is one of the most targeted ingredients with this argument because it was never even in that vaccine that was originally purported to have or said to have an association with autism. Next is adjuvants. So adjuvants help the patient mount a better immune response to the vaccine. So we need to give the patient, in order to make the vaccine more effective, we use some compounds that will make the patient mount a better immune response. The most cited concern is aluminum salts that people will see on the ingredient list in vaccines. The amount of aluminum in any vaccine is minuscule compared to the amount that you are exposed to in your food, water, and environment. So just by living, and breathing, you are being exposed to significantly more aluminum than you are in your vaccine. So it's really not something to concern yourself with. If you are going to be alive, you might as well get a vaccine and have further safety because it's not anything close to what you get just from living an everyday life. There are some additional components, and again, here remembering that we do need to put some things into these vaccines so that they work. So we have some stabilizers like sugar and gelatin that really help keep the vaccine potency in transport. They do need to be transported all over the country, so just we're remembering that we might need something to really hold the product. Egg protein and some other substances are used to encourage growth of the vaccine. We do need kind of a growth medium in order to make sure that we have enough of the virus to use to inactivate to inject into a patient. So egg protein was very commonly used as a growth medium. It's not as commonly used anymore. We've developed some other methods. However, I do think it's very important to note that egg protein growth in the manufacture of a vaccine does not mean that a patient that's allergic to egg can't have the vaccine. There have been many studies done on this, and we've come to the conclusion that patients will not have an allergic reaction to this, even if they're allergic to egg. So that is something that you can tell your patients. You also have things like formaldehyde and antibiotics, and these are used to prevent the production of toxins, the growth of bacteria, the growth of viruses in the actual product, because again, you don't want the product to become contaminated and then inject it, because that could be an issue, because that's not inactivated, then that is it has gone bad, it has been contaminated, and you wouldn't want to inject that in a patient. So the small amounts of formaldehyde and antibiotics that you may see listed on the ingredient list, that is the purpose of them in this case. Another argument that I see very often is that the number of vaccines that we give our children is too many. So to take a step back, the first thing to remember is that the goal of our childhood vaccines is to protect children from these diseases as early as possible. I have a very small niece and nephew, and it's scary in that time period if they're born like around flu season and they can't get a flu vaccine yet because they won't mount an appropriate response until they're 6 months old. It's a scary time period. You want to get these children covered as soon as possible. And again, I think parents have a hard time wrapping their mind around this because they have never seen a child with tetanus or with pertussis, and those are not negligible illnesses. They are not without a lot of negative repercussions, and they're very scary illnesses. So remembering that we're trying to protect these kids as soon as possible. And they're at an increased risk. Children can get very sick if they get the flu, as most people can, but especially the small children. So just remembering that the goal is to really give them those vaccines as soon as possible, and that children are exposed to exponentially more antigens just from living every day. So antigens you can essentially think of as like part of a germ. And that's what the concern is, that, if I will overwhelm the immune system if I give too many at one time. Why are we giving so many injections? But the amount of vaccines that we give to children on the normal schedule does not even come close to what they encounter even just in your house every day, from touching the floor, touching the doorknobs, and just being. So their immune system is well equipped to handle the amount of vaccines that we give them. It does not come close to living. So this really doing delayed vaccine schedules really only just puts the children at risk for a longer period of time. Other conditions of concern that I would like to discuss are febrile seizures. So there is a risk of having a febrile seizure after having a vaccine. Any child that does have a fever is at risk of having febrile seizures. So just remembering that if the child were to get any of the illnesses, such as the flu that you're protecting against, they are at risk of having a higher and more prolonged fever, and then still at risk of having seizures. So really not giving them a vaccine because you're afraid of them having a febrile seizure doesn't completely make sense, because they're at higher risk of having febrile seizures from getting the illnesses that you would be protecting them against. Similarly, there's something called Ombr Syndrome. It is an autoimmune disorder that can occur after a patient has mounted an immune response to something. For example, my father actually had Guillain-Barré after having Lyme disease. So in his case, he had Lyme disease. His body mounted an immune response, and then he ultimately, his body kind of kept attacking itself, and he had Guillain-Barré. This can certainly happen with vaccines because the mechanism of vaccines is to mount an immune response. However, as with febrile seizures, if you were to get the flu or get any of these illnesses, you are also at risk of having Guillain-Barré syndrome, and you are at a higher risk of getting the flu if you don't have a flu vaccine. So just kind of going down that pathway and say that while these things have been seen after getting a vaccine, it's not the vaccine itself that's causing it, and by preventing someone from getting those illnesses, you're actually protecting them, and they're less likely to have these effects. Unfortunately, sudden infant death syndrome is something that has been targeted as a concern after vaccines. There has been no association found between getting the vaccines and sudden infant death syndrome. Obviously, I think we all wish we had more answers as to why this happens, and we don't, which is why it's called sudden infant death syndrome. We don't know what causes it, but there hasn't been no association found. And finally, autism. I think we've talked about this a lot today, but I think it's very important to just discuss the fact that a lot of people say that we have more vaccines now, and now we have more autism, and that's their association saying that they must be related. To start off, we don't necessarily have more autism now. Healthcare has progressed. We have a lot higher rates of diagnosis now. So there's really no way to know comparatively to the past, like actual rates, because we have a lot more documentation and a lot more recognition and a lot better understanding now. So it's not necessarily that there's more. And then also remembering that while we do give more vaccines, we also do more of everything. We have cell phones, we have iPads, we have more computers, we have all sorts of electronics. We have more of everything. Time has changed, it's modernized. So if you're going to say that we have more of this, so that has to equal this, that doesn't quite make sense, and we have no science to support that concept. So just remembering that if you say someone says, oh, we have more autism and we have more vaccines, I can say yes, but you also have iPhones and they didn't exist before. So just again, kind of always coming back to logic and thinking through these pathways. So this was a study conducted recently to evaluate the association between the MMR vaccine and autism. And something that I think it's very important to remember is that research takes a lot of time and a lot of money. There is the healthcare community has no question about vaccine safety and the fact that they are not at all associated with autism. So remembering that the impact that the anti-vaccine movement is having is so large that these investigators thought it was worth the time and the money to actually do a study to prove that fact. And if anything is going to tell you the significance and the danger of what an anti-vaccine movement could cause, this is it, and it's one big thing to pay attention to. So this was a study done to determine if the MMR vaccine increased the risk for autism in children. The population was close to 660,000 children born between 1999 and 2010. They found that there was no increased risk for autism. They also found that there was no association with the development of autism in susceptible children. There is a concept out there that maybe if you have a child that's not going to have autism, they'll be fine regardless of whether or not you give them a vaccine. But if you have a child that might be more susceptible to having autism, that a vaccine would like push them over the edge into autism. That's another theory that is shared on the internet a lot. So they set out to kind of address that in this study and found that there was no association. And they also found that there's no association with an increase in autism a certain time period after vaccination. So a lot of times anti-vaccine movements are kind of directed at the time of my child was fine, I gave them a vaccine, and now they're not fine. So they evaluated in this study if there was any significant increase in certain time periods after vaccines, and there weren't. So again, I think if you take anything away from this presentation, I would just like it to be remembering that you need to always be thinking of risk and benefit. Everything that we do in healthcare is an evaluation of risk and benefit. So it's so important to remember that no treatment is without side effects or risks, and keep that, for me, I think the one thing that shows it to me is keeping it in perspective. We had all of these infectious diseases in the 20th century that were, again, experiencing coronavirus now is nothing even close to what it was like back then. The medical community came up with this miracle of vaccines to get rid of these illnesses, and now we're expecting it to have absolutely no risks. And I don't think if we had lived through that, we would really think that that was a reasonable ask. No treatment is without side effects. people can have an allergic reaction to anything. Unfortunately, bad things do happen in this world, but um, they created a solution that was very effective at close to no risk, and just kind of keeping that in perspective, that compared to the alternative, this is very much the best option. And just thinking about different things that impact our health. So, we become so hyper focused on very specific things, or like questioning vaccine safety, but remembering that sedentary lifestyle and poor diet have been shown to be associated with way more risks than vaccines, but we're still not seeing as many movements to address the obesity epidemic across the world. So again, just the thinking about these things, and really where we should be targeting our focus, and how we should have these discussions. So in terms of talking with patients, just remember that to use a strong, direct language that assumes vaccination. So you really want to start at a baseline that says there's no reason in which, as long as your child is not contraindicated to getting any of these things, that they shouldn't. So kind of starting at that baseline that you assume that they would vaccinate their children. And then remembering just to keep the conversation open. It is not the goal to change everyone's mind or get through to them in one conversation, but what you want to avoid is them shutting the doors down and saying, I'm right and I don't want to talk about this anymore. So by keeping the conversation open with them, maybe you can encourage them to have a conversation next time they're at their pediatrician's office, and really just kind of planting the seed and giving them some things to think about. You don't have to do it all at one time. And really focus on the purpose of vaccinations. Just remember that most parents, one, don't have any scientific background, and that's fine, and also haven't witnessed the severity of illnesses. And most people, I think, if they've seen the severity of the illnesses, they would certainly have a different perspective. But it's just hard to imagine in our everyday life where we don't see things like that. And always remember to bring discussions back to the benefits outweighing the risk. Say, okay, I see that you have this concern with a vaccine. You can kind of explain why that concern is not a concern, but then also, even if you can't get through to them in that sense and they still do believe it's a concern, ask them if the risk that they are concerned about outweighs the risk of everyone stopping vaccinations and what would happen then. And just remember that these illnesses will come back if we stop vaccinating. So I think a lot of people think oh, that's in the past, they're gone, we vaccinated, we can stop vaccinating now and nothing will happen. No, they're going to come back. We have seen that with polio, we have seen that with measles, and we don't have treatments for many of these things. Modern medicine can't snap its fingers and cure these things, as hopefully we are seeing with the coronavirus. So again, just remembering that if we stop vaccinating, the infections will come back and we don't necessarily have treatments for all of them. All right, and now we will do a quick check on learning. Which of the following does the influenza vaccination decrease the rates of? A, hospitalization, B, influenza infection, C, intensive care unit admission, D, death, or E, all of the above? And the correct answer is E, all of the above. As we discussed in the presentation, getting an influenza vaccine prevents much more than just the influenza infection itself. What is the purpose of Thimerosal in vaccines? A, helps the patient mount a more robust immune response. B, helps prevent contamination of the vaccine. C, helps grow enough virus to make the vaccine. Or D, helps inactivate toxins during the manufacturing process. And the answer here is B, helps prevent contamination of the vaccine. Remember that adjuvants help us mount a more robust immune response. Things like egg protein and other growth mediums help us grow enough virus to make the vaccines, and things like formaldehyde help us inactivate toxins during the manufacturing process to make sure that the product remains pure prior to administration. True or false? Patients are at an increased risk of developing Guillain-Barré syndrome after receiving the influenza vaccine versus contracting influenza without vaccination. And the answer here is false. As we discussed during the presentation, patients are at an increased risk of contracting influenza if they do not get the influenza vaccination, and therefore are subsequently more likely to having Guillain-Barré syndrome, as opposed to their risk of developing Guillain-Barré after vaccination. All right. Well, I would like to acknowledge Brian for one of the pharmacists at UVA for helping me with this presentation. And I thank you all again for tuning in to take your CE.